Thanks, Paula, and thank you to the previous two speakers for keep mentioning our future health. So it saves me some work to do in what I'm going to talk about around trust and transparency. But I sort of want to kind of cover three things during the next few minutes. One, just give a little bit of context about what our future health is trying to achieve, and then why trust, transparency, and what we're trying to build with the public is so critical to the success of that. Talk a little bit about the work we've done in understanding how we build some of those, or break down some of those barriers to earn the trust of the public, and then think about how that kind of comes together around the Alliance. So our Future Health, I think Mark mentioned it earlier, is an industrial strategy challenge fund project funded by UKRI. We've got a significant amount of government funding, a significant amount of industry funding, but it's creating one of the world's largest resources for health research. So this will be a flagship with not only within the UK, but outside of the UK for health programmes in the future. It's a 5 million person cohort, and despite the fact that the population grew a little bit, if you were following ONS's announcements this morning on the census, it's still about 1 in 10 of the adult population that we need to activate to convert into a participant in the programme. That becomes really simple. You consent, you give some data, you collect a questionnaire, we ask for a little bit of blood. There's a whole separate talk I can tell you about how do you try to collect 5 million blood samples, which convert into 53 million tubes in a big freezer. But importantly, it's what's that activation to get people to start? How are they going to use their data? What is it that we're going to do with that? And what are the actions that we take that become important to them to think about that? We're starting ultimately from a zero baseline. This is people getting a letter, an email, a communication from someone who they've never heard of. It may have an NHS badge on it. It may have a charity badge on it. It may have a other cohort badge on it. But how does that convert into people agreeing to do something which involves sharing data? And that's where the sort of trust and transparency pieces become key. So from the very beginning, and we started this actually at the start of the pandemic, it's probably not the best time you ever want to start a new cohort study where you're collecting blood. But we started around then with sort of involving the public really from the very beginning in every single thing that we did. So whether that was designing the protocol, information sheets, the consent form, the partnership relationships that we had with the pharmaceutical industry. So we talked to them about what we were doing and what we were offering. We listened to that. We involved probably in excess of about 160 members of the public in various focus groups and co-design groups. There's upcoming work now about giving people feedback about their health. We have public advisory boards, but we also have public members on most of the governance boards as well, so that it is embedded in the heart of what it is that we're trying to do. And where we haven't got established processes, and Claire touched on it earlier around the sort of NHS secure data environments and how we're building the sort of accreditation process, we're also doing some of that work to think about our environment, which is slightly different because we have consent of participants. But we've worked then closely with the major external agencies to help reassure people that what we're actually trying to do is embedded with the Information Commissioner, with the National Cyber Security Agency at GCHQ, with others who are giving us advice on how to do this to the highest possible level at the best possible standard to ensure that the trust is what we're actually trying to build. And actually a lot of research that we've done relatively recently has sort of helped us to understand some key facts about this. So most people, when they read and listen to what we say, actually have an inherent level of baseline trust in what we're actually saying. But that doesn't translate to partners who we work with. So there's a lot of a disconnect between what we do and what we will do with partners, and we have to think about what that bridge is to be able to enable trust to transfer. Most people are self-reflective and critical of saying, well, public involvement is good, but use the public for what they're really good at. Don't just involve them for the sake of involving them. Involve them because actually you want some meaningful dialogue, meaningful conversation, and you will act upon the results of what they tell you. And ultimately, and I think the most underpinning thing is that transparency is critical. You can say whatever you want, but unless you can underpin that with the works that you're actually doing, and you can demonstrate how you're acting against the principles that you lay out, it becomes a really sort of difficult area to sort of demonstrate to the public. I think the other thing that's really important to say is often in conversations where we talk about trust and transparency around data and data infrastructure, we often solely focus on the public and forget about there are many other professional groups and agencies who we need to have a voice on. Some of those are critical and some of those are supportive. But it is not just the public who make up their minds on their own. It is the public in consort with a number of other people, and it's important to ensure that we bring those people on with us. So I think Paula sort of alluded to why do you join the Alliance and why join this? Well, these are incredibly difficult problems that we're trying to solve. I've got a huge problem to recruit 5 million people and get blood off 5 million people and get them consented into a programme. I don't also need to solve all of the other problems where actually HDR and the Alliance are laying out what the best practices are around transparency, around engaging the public. And also the learnings that we're getting from the work that we're doing, how we can feed that back into others so that they can benefit from the work that we do as well. And ultimately, what we don't want is a lot of different and individualized solutions. The collective power of doing things as a single voice is far better than having lots of solutions which will confuse people more as to what we mean when we talk about health data and health data infrastructure. And I think particularly the success that Andrew and the team at HDR have had over the past few years, particularly during COVID, showing that the focus on single mission-driven events is really the critical thing which actually unblocks and stops the hindering of sort of research and progress, is something that we all should rely on in the future. It should be driven by a mission, it should be driven by a particular vision. And ultimately, if we do that, I think that's where ultimately in the future, through the Alliance, we can see the greatest success. Thank you.